In a people-heavy organization, culture isn't just a nice thing to have. It directly affects the quality of service, right?
So I feel like there isn't really a trade-off that needs to happen. It's just all about designing the systems to do the right thing in the best way from the start.
So what made you believe AI and technology could support care teams rather than take away the human side of care?
AI didn't replace the human work. It replaced the admin that was getting in the way of human work. Before adopting AI, make sure the data is clean. If you've got good data, your AI will produce some really good insights that'll help you. But if your data is poor, it'll misguide you.
Hello everyone and welcome to the first episode of The Founder's Instinct. I'm your host Shaheer Khan, and in today's conversation we'll be looking at leadership in social care, responsible AI adoption, workforce culture, and what it takes to transform a people-heavy organization without losing its human purpose. Our guest today is the CEO of Oakland Care Group, and he has led meaningful transformations in social care with work spanning person-centered care, governance, technology, and team development. He is also the board director at West Sussex Partners in Care and has been recognized among leading voices in the care sector. It is my great pleasure to welcome Mr. Kevin Humphrey. Hello, Kevin. How are you doing today?
Thank you very much. It's nice to be here and a real pleasure to be on your very first podcast.
Thank you so much. Kevin, before we begin, we would like to know about your journey. So how did your journey lead you into social care leadership?
Well, it's a bit of a strange one. I came about it in a bit of an odd way, I suppose. I had a history of working in HR, recruitment. I was even a bank manager, and I managed some branches of a car rental hire company. So that was my history. And what I'd been doing, I'd worked in a number of financial businesses, and I'd worked to do turnaround projects just to kind of make sure that they were doing things efficiently, so that they could turn around their fortunes if they weren't making money. And I'd done a couple of these when somebody who I knew was a trustee of a charity that delivered care within the community of Brighton, Hove, and East Sussex. And they were in a bit of difficulty. So he asked if I could just do a few weeks at their charity to see if there was ways that it could be turned around. They were losing an awful lot of money every year, and they couldn't continue in that vein. So I did a few weeks there, and I came up with a business plan to do a turnaround. Anyway, that was my first step into social care. And they said, we're going to need to recruit somebody to manage this turnaround. Would I be interested in applying? So I applied, and I was appointed as the CEO. And I remained there for 3 years while I carried out the turnaround project, and it was successful. I'm glad to say, and the charity is still going today, which is 16 years on. So that was my first step, and it was a real sharp learning curve to go from normal business management, I guess, into social care. It was a real change, but the key difference, I suppose, was when I remember somebody saying to me, thank you for all that you do. You've really made my mother feel like she's seen. And do you know what?
That's nice.
That has stuck with me forever. Literally has stuck with me forever. And I kind of just realized, I think this is the sector I want to be a part of. Previous to that, I'd been making people with money get more money, right?
Yeah.
But now what I was doing was I was making a real impact on people's lives, people that genuinely deserve to have the right care, the right people coming in to see them, people who wanted to be there and spend time with those and make their lives, improve their lives, make their lives better. And actually, that really meant a lot to me. And I thought, you know, this is where I want to stay. This is where I want to work. I found something that I not only enjoy, but it's really worthwhile.
That's nice, Kevin. You have quite an experience and it's very inspiring.
Thank you. That's
So,
very kind.
so Kevin, you are the CEO of Oakland Care Group, and every leadership role has that early phase where you're trying to understand the organization properly, right? So, when you stepped into this role, what were the biggest challenges or opportunities you saw early on?
Okay, so I think the biggest thing I noticed was how much people were spending all their time on paperwork. So you had people who were really experienced, they were skilled individuals, and yet they were sat behind a desk for hours and hours and hours. And it was really draining on the ability of the teams to be able to spend time with the residents. And another thing as well was, um, systems were fragmented. You would be rostering in one place, care records would be in another, maintenance would be on in a book. Um, there was some stuff that was on a spreadsheet, stuff on a paper, stuff on a web app, and it was just all over the place. So the opportunity, I think, was quite obvious. It was about reducing the administrative burden so that we could unlock the capacity for actual care. And the real question was, of course, how do you do that without cutting corners on quality or compliance, but actually reducing that creep that we've seen over so many years of admin becoming a bigger and bigger part of social care, and actually bringing that down to the level that was not only much more manageable, but actually making the roles and the purpose for those people in those positions um, to be much more meaningful.
Right. And how did you decide what to prioritize first?
So I think the first thing to prioritize was getting getting the biggest pain point, the biggest drag on time, and making sure that that was the thing that made the difference by basically looking at a workaround to
Yeah.
actually cut that down. And so what we actually did was to make it so much easier for everybody to get access to everything. So putting everything in one place. So there was no more paper. Everything was on one system. Everything was uploaded to one place, and then making sure that the accesses were in the right place. So you had different tiers of access so that anybody that needed something could go exactly to where they were permitted to go, and everything they needed to do their role properly was there. And then somebody else would have access to this, but to another tier because they needed more oversight. So we was managing the GDPR from the very beginning, from its very concept, to ensure that
Oh,
everybody was able to make the most of their positions whilst not sharing too much information, which was unnecessary.
great. Okay, Kevin, one thing that stood out to me about your transformation work is that you don't include change for the sake of change. It's built around clear principles. You want to add your clear principles into that, right? So, you've spoken about person centered care, disciplined governance, and responsible use of technology. How did those principles shape your approach, and how do you make sure those principles are actually reflected in your day to day operations?
Okay, so first of all, then, how did they shape my approach? I guess I'd say that they're not separate things. They're actually the same thing, but they just come from sort of different angles. Person-centered care means your decision, whatever you're doing, it starts with the resident. So you're not actually
Yeah.
asking, so what's efficient, but what does Mrs. Johnson in room 10 actually need. Uh,
Yeah.
and technology, therefore, only earns its place if it serves that very purpose. Disciplined governance. Now, that came out from recognizing that AI specifically can be dangerous without guardrails.
Yeah.
The way AI works, it has all this knowledge in the background from everything that's being produced and is available on the internet. And then through a probability, it predicts the next word, the next word, the next word, based on what it's read a million times over, possibly even a billion times over. So
Yeah.
it's no reason to it. There's no care behind it. Um, so even if you ask AI, why do you recommend that action? It will generate a very plausible sounding explanation, but that explanation is just as much a fabrication as any hallucinated fact. There's no actual reasoning to report. So once you understand that that's the model that you're working with, then your governance has to be really strong so that you're taking into account that this is a tool that you're using that can support the practitioners who know the individuals, who care for the individuals. It's a
Yeah.
tool that can enable them to get their work done. So what we built was what I've coined a glassbox framework, and it's adopted from the Oxford Institute for Ethics in AI, their 7 principles. And the core commitment is this: every AI output must be reviewed by a qualified human before it affects anybody's care in any way, and there's no exceptions to that rule. You got to think that what we all want in care is for care to be good enough for our own mother or father.
Yeah.
So therefore, if AI's produced it, the only way that output is going to be good enough is if a person who knows that individual exceptionally well goes through
Yeah.
it with a fine-tooth comb and says, yes, that's good, or tweaks it to make it good.
Yeah. You were talking about the mother test, right?
That's right.
Yeah, I've seen some of your previous podcasts and I caught that, the mother test. And it's a
Absolutely.
really good thing. Yeah.
I've always called it the mother test because if it's not good
Yeah.
enough for your own mother, then we just
Yeah.
don't do it.
That's great. Kevin, social care feels like one of those sectors where operations matter, but human element matters even more. So if operations are weak, people can see that, they can feel that. But if the focus becomes only operational, you're at the risk of losing the heart of care. So how do you balance efficiency, quality, compliance, and dignity of the residents? And how do you measure success beyond financial or operational metrics?
So that's a good question. So I think there is a real tension between those things, but I think I've come to see it a little bit differently because efficiency and humanity don't necessarily need to be opposite ends of the scale, because bad systems would be the enemy of both efficiency and humanity. Um, if a care practitioner is spending 40 minutes hunting for information across 3 different platforms, that doesn't produce quality or efficiency. When they're scribbling notes during a conversation, instead of just listening, the resident knows that. So,
Yeah,
we've made deliberate choices. So, for example, that dignity and the efficiency and the quality and the compliance can all be sat in one place in one unified format. A good example would be when somebody is coming to us as a new resident, we'll complete a pre-admission assessment. Now, historically, that was done on paper. So, the care practitioner would be head down, writing their notes while asking the questions. And then they
mm,
take that back and they try and use that to write a care plan. And then that would take a long time. I mean, we're talking 4 hours was our minimum, 8 hours was pretty normal. So what we've come up with now is a new system where they sit with a person, they press record, and it records the individual onto an AI system that transcribes it. There's no voice recorded, just the transcription. When that transcription is completed, that will be the basis of the care plan. But during that conversation, that care practitioner is fully present, fully listening. The only time they look down is a prompt for a question from their paperwork. They're never writing anything. They're never having to take notes because everything is captured via the transcription. Then that transcription often captures much more detail than they would have done in their own written notes. And then that goes
Yeah.
into our AI system, and that actually produces a care plan that is often much more person-centered than what we were doing previously. So, you know, what we're seeing there is efficiency, quality, compliance that comes from the fact that these systems are all GDPR compliant,
Yeah.
and dignity for the resident because they're actually spending the time with that person and showing them dignity, not just talking about it. So I
Yeah.
feel like there isn't really a trade-off that needs to happen. It's just all about designing the systems to do the right thing in the best way from the start.
Yeah. Totally. Let's talk about AI and technology in care. So, a lot of people still see AI as something that might make services less personal, especially in a sector like care. But your work seems to take the opposite view, that technology can actually give teams more time to focus on people. So, what made you believe AI and technology could support care teams rather than take away the human side of care?
Well, I think the example I've just given is a really good one. So,
Yeah.
before we brought in this this new AI way of working, um, the care practitioner would be half present, scribbling notes, constantly trying to capture everything. Then they'd go back to the office and spend hours trying to put that into a structured care plan. Well, now they're fully present, they're listening, they're connecting. The secure AI system records and transcribes that conversation, and that then goes into a GDPR compliant environment. And AI drafts a structured, person centered care plan from the actual words spoken. Now, the practitioner
Yeah.
goes in and then reviews everything, corrects, might add context, and finally they approve it. Now, AI didn't replace the human work, it replaced the admin that was getting in the way of human work. So,
Yeah.
what I'm seeing from AI is yes, AI is a cause for concern, but it's only cause for concern if you don't have the right intentions, you don't have the right framework, and you don't have a good strategy from the beginning with the data to back it up. It's all about making sure that it's there to support the human side of care. If it doesn't do that, it doesn't have a place.
Yeah. So you've focused on workforce development, staff feeling valued, and creating proper career pathways for your staff, right? So in a people heavy organization, culture isn't just a nice thing to have, it directly affects the quality of service, right?
Yes.
So, from your experience, what have you learned about building a culture where care teams feel more respected and motivated?
So I think, first of all, yes, I agree that the culture is absolutely one of the most important things. It's one of the hardest things to change in an organization.
Yeah.
But if you work at it and you build that culture over time, you end up having a team of people that are all on the same page. They all want the same thing. They're all going in the same direction. And
Yeah.
for for them and their lives at work, and for the people for whom they care, the difference is enormous. So what we did, we started with the language that we use. So we don't use terms like care worker or care assistant. For lots of different reasons, but not least of all because those terms suggest a task-based and low-level work. Whereas what we know is staff make clinical assessments, they make health judgments, they manage complex medications, they provide end-of-life care. So they're practicing care. They're not assisting care. They're not working in
Yeah.
care. They're practicing care. So they're care practitioners. In Oakland Care Group, we call them care practitioners. Then to make that respect from that language tangible, we built a formal career structure. So people come to us and they start as a care practitioner, they become an advanced care practitioner level 2 and level 3, a senior care practitioner, level 2 and level 3, a lead practitioner, and then on into deputy manager and registered manager. And each tier has defined competencies, responsibilities, and incremental pay. So staff, as soon as they join us, they can see where they are now and where they're going. Also,
Yeah.
we're a real living wage employers.
Yeah.
Now, do I think that's, am I giving myself a pat on the back of that? No, I'm not actually, because it's still not enough. NHS healthcare assistants doing identical work can earn several pounds more. So
Yeah.
the real living wage for us is a floor we refuse to go below. But I believe that we need to do more and we need to get higher. Our teams need to be paid exactly what they are worth, and they are worth much, much more than social care as a sector is able at this time to pay them.
Yeah. I always say this to anyone who asks me, business isn't really about just money and profit, revenue. It's also about the people. If the people are happy, your business will automatically take off.
I couldn't agree more. I think
Yeah.
if you really want your teams to care for your residents or your clients,
Yeah.
they need to feel cared for. If you care for them, they will care. You won't need to be telling them what to do because they will genuinely care. And so, with our teams, we do everything that we can to support them, to value them, and to care for them in a very real way as individuals that they are. So we talk about person-centered care, but I think that
Yeah.
applies equally to our staff teams as it does to all our residents.
Yeah. Absolutely. So, Kevin, from the outside view, transformation can look very clean once the results are visible. Looking back at the transformation, what was harder than expected, and what decision made the biggest difference? What would you approach differently if you had to do it all over again?
Ooh, yeah, that's a tough one. I think I
Yeah.
would probably say that the hardest bit was getting your head around exactly what you should be doing. So when AI first came about, and everybody was experimenting with ChatGPT, the free tools and whatever was new, you kind of think, okay, so you can see from your own personal life and your usage how this might be able to be helpful. And I remember thinking, okay, so maybe we can use this. And if we're going to try and use this, we have to do this in a way that doesn't use resident information, doesn't use people's information, and so on. Um, and so it was challenging. And so what we did was we drafted our first governance document. Um, Not very glamorous, pretty tedious, but nevertheless essential.
Yeah.
And it was, if I remember correctly, it was 3 pages long. And it really just talked about, what were the constraints. Then we started to utilize Microsoft 365 Copilot and CareSpace. And this then developed into data protection impact assessments, data protection agreements, making sure that tools were used only for those things that they were designed for. For example, we've only got two specific AI chats. That's CareSpace, anything involving resident data, and then Microsoft 365 Copilot for non-resident information, reports, emails, planning, that sort of stuff. And
Yeah.
And our governance now has just increased to 56 pages, with a lot of detail. But what it does, though, is it ensures that what we're doing is right. It ensures that our staff teams are trained in the right way to use those tools. It ensures that people know that anything outside of that framework is not to be used with anything to do with staff, resident, or business information. Every tool has to meet our governance standards. Um, and I think before that stage, everything felt so unwieldy, like as if it was too much to get your head around and to control. Uh,
Yeah,
so I think the best thing to do is to start small, to write your governance framework, and it doesn't matter if it's no good. Just write your governance framework because it gets you thinking. Once you've started, you start to develop, and you think, oh yes, but actually I need this now, don't I? And then move on to the next stage. So for us, I think it was very, very difficult because we were trying to restrict people from the beginning. And what we needed to do was just put all the parameters in place so we could allow people to do everything.
great. That's great. Kevin, we're just around the end now, and I'd love to make this practical for other leaders listening, especially those trying to modernize traditional and people heavy organizations. So, what advice would you give to leaders trying to modernize a traditional people heavy organization without losing its purpose?
Okay, so that's a good one. I think the first thing to say is involve your people.
Yeah,
And I don't mean like consultations and stuff like that. I mean actual genuine involvement, right?
yeah,
You mustn't feel as a member of the team that you're having technology done to you or that you're just being given a package that's already decided. What you need is you need the ability to shape it from the beginning.
yeah,
I think if staff feel as though they are valued in the opinions that they've got, in the way that they work, then they'll have buy-in to it from the beginning. They'll have an input into what it looks like, and it'll fit with what they do every day. Otherwise, what you're doing is you're assuming that you know better than the people who are actually doing the job.
yeah,
And you're imposing your way of working upon them. And that's never going to work because if it doesn't meet the staff exactly when they need it and where they need it, they just won't use it. So I think
yeah,
I think that's probably my most important point. The other thing is as well is your teams need to feel like this is actually worthwhile. So if you want your teams to feel that it's worthwhile, then you have to ask the question: um, is this technology bringing us closer to the people we care for, or further away? If a new system just means that staff are spending more time on screens and less time with residents, then it's failed. It doesn't matter how efficient you find something; it's not doing its job.
yeah,
Um, Purpose doesn't come about because of the new and shiny program or just simply because it's modern. Um, you know, it should be the filter really that tells us that a change is worth making in the beginning. So I think that I would say if your staff are involved and it's actually got a real purpose to bring us
yeah,
closer to the people we bring care to, then I think you'll be doing things from the right road. But the only other thing to add, which isn't people centered so much, but before adopting AI, make sure your data is clean.
yeah.
If you've got good data, your AI will produce some really good insights that'll help you. But if your data is poor, it'll misguide you.
That's some really solid advice. So, Kevin, I really appreciate you taking the time and being part of the series. You're our first guest on the Founder's Instinct. So, this conversation will always be a special one for us. And thank you so much for joining me today. It's been a real pleasure having you on.
Well,
Yeah,
thank you very much. I've thoroughly enjoyed the conversation. I just hope that out there some people may find it useful, and hopefully feel as though they've got um, a little bit of confidence to make that journey into utilizing AI in a way that is both purposeful and useful for their staff, and to those they deliver care to.
Of course, of course. And to everyone listening, thank you for turning into Founders Instinct. If you found this conversation valuable, follow along for more honest conversations with founders, CEOs, and operators on what it truly takes to build, lead, and scale organizations. Kevin, thank you again.
Thank you.